Breast cancer, throughout many, many years, has had a stereotype of only happening in women. I know I had never previously thought men were capable of getting a cancer that predominantly happened in women. This presentation is to give you more information about male breast cancer and maybe why the knowledge of it is so scarce. Breast cancer in men is very rare compared to that in women. 1 in every 1,000 men gets breast cancer, and less than 1% of breast cancer is men. These may seem like good odds, but with the lack of knowledge on how to cure it, it is very damaging. With the difference between the anatomy of a breast in men and women, it is hard to determine how this disease will affect a man. Unlike women, men do not have many symptoms, making it hard to discover and often found in later stages. Boys and girls have similar breast tissues at young ages, and when boys hit puberty, high testosterone and low estrogen levels stop the male's breast from developing. Though after puberty, some milk ducts do stay existing in men. And this is where most breast cancer begins. And if it is not caught fast, it can spread outward. Fewer than 2% of breast cancer starts in the lobules. Some methods of treatment used in women are also used in men. And male breast cancers are hormone dependent. And oftentimes doctors use estrogen blocking treatments like taxoxifene to help treat male breast cancer. And taxoxifene is used in both male and female to help prevent and treat breast cancer. Method of treatment depends on what stage the cancer is when it is diagnosed. And most often it is diagnosed in late stages for men. The four most common treatments for male breast cancer are surgery, chemotherapy, hormone therapy, and radiation therapy. Further research is needed to completely understand how hormonal agents work in men.
All right, let's see if I can hit a 7 on it.
56-year-old Michael Johnston usually spends most of his time on the golf course, but not this year.
This is the first time I've swung a club this year. So, watch this one, right up into the trees.
Michael's time and energy is now spent fighting cancer, and it's a type of the disease most of us associate with women. Michael has breast cancer.
I was a hospital corpsman in the Navy for 6 years. I knew these things could happen. Did I really expect it to happen to me? No. Hello?
Dr. Beth Overmoyer is Michael's doctor. She's a breast cancer expert at Dana-Farber Cancer Institute in Boston. She says for many men, a diagnosis of breast cancer can be embarrassing.
Suddenly a man is faced with not only having cancer, but having cancer where the predominant color, representative color, is pink. So we need to really overcome that because male breast cancer is treated very effectively, and it is the same cancer as that in a woman.
And like women, Dr. Overmoyer says it's important for men to know the warning signs. The most common symptoms of male breast cancer include a lump or swelling in the breast, skin dimpling or puckering, nipple discharge or retraction, and scaling or redness around the chest.
Come on, Pug. Let's go.
Undergoing a mastectomy and chemotherapy to treat the cancer has meant a tough couple of months for Michael and his family. But he caught his cancer early and wants to warn other men they need to check for breast cancer too.
The people I work with, a lot of them were doing self-exams right away. You know, they never knew they had to do that. They said that, they're examining other parts of their body, and they said, now we're going to add this to the list.
Michael says helping others helps him feel good, and staying healthy helps at home.
I do have a good attitude, and I've assured my wife that I'm not going anywhere, so, I have to stick to my word now on this one.
At Dana-Farber Cancer Institute in Boston, I'm Ann Dorr reporting.
When doing a self-examination, men should check for small bumps and look for changes in the breast sizes or shape. Some risk factors can be hereditary, hormonal, or pathologic. Some hereditary factors include a history of breast cancer, men or women in the family, and same with ovarian cancer. Some hormonal factors can be their height or their weight, and pathologic factors include the number of biopsies they've had or tumor markers.